You've built your business over decades, and now it's time to think about that once in a lifetime exit. You've come to the right place. Here, you will hear business exit professionals talk about what you should know before exit. Hi, I'm Armando Roman, family CFO at Axiom Founders Family Office, a wealth management firm in Scottsdale for founders' families. Here at Axiom, we know you want to be financially confident and secure. And the problem is, there's so much noise and just plain bad information out there to make informed choices for your family, especially when you own a valuable business. And that can make you feel confused and frustrated, which is why the FBI asked me to train 400 FBI special agents, all of them CPAs, to train them in their own personal financial planning. So call my office today to schedule your 30-minute founder strategy call at 480 367 9000. There's no cost, no obligation. You have nothing to lose. Enjoy this episode of the Founder's Guidepost. Hi, Armando here with Dr. Dan Wool, a naturopathic physician here in Scottsdale. Dan, how are you today?
Doing great, Armando. Thanks for having me on. Real
Great,
privilege.
fantastic. So I want to help people understand what you do because I think there's a lot of confusion. What is a naturopathic physician? And you helped me understand just very, very recently, Dr. Wool, that you function somewhat as a primary care physician, although your toolkit is much more expansive than the primary care physician that I've had forever. So maybe you can touch on, first of all, what is a naturopathic physician, please?
Absolutely. So naturopathic physicians we're trained the same as any other MD. I think philosophically we are a little bit different where we really look at the big picture and then really try to drill down to root cause, really try to connect the dots. And I work with a lot of chronic disease. And then I also work in a new paradigm, which is that we go to the doctor when we're well, not just when we're sick. And most of us know our own primary care physicians through the insurance mediated system, and they're very well meaning and very good, but they don't get an opportunity to spend a lot of time with people. And they also are trained in hospitals. Hospitals use medical algorithms, and if you're in there for an emergency, these are absolutely life-saving. This is, we're seeing this, we're testing that, and therefore you get this drug or this intervention. In the case of something very serious that you're going to the ER for, you want that quick decision making and you want, kind of in and out type decisions like that. But with more chronic disease and in more the primary care setting, that doesn't really apply as well these days. And so, when you and I grew up, we knew our doctors, the doctors knew us, they knew our families. And that's more of what the naturopathic physician does these days. We're more family practice. We get the opportunity to spend a lot of time with people. My first visit's 90 minutes with people, and most visits are 45 to 60 on follow-up. So, we really get to know your total health picture. And then again, it's more focus on prevention. And that way, when there's little blips and abnormalities, we can jump on it very quickly. And I think
Wow.
that's very relevant to your audience who, health is wealth, right?
Right,
We
right.
need to stay healthy to serve our families and our companies.
Exactly, exactly. And can you touch on, I think of I've seen, as many of us have, a primary care physician every year for a physical checkup, and that's the mode I've grown up with, and many people have.
Yeah.
And I understand they go to medical school to become a physician, and they practice now as a primary care physician. What does the medical school look like for a naturopathic physician?
Yeah, in our naturopathic medical school, we're still the first couple years are very similar to a regular medical school where we're taking every science under the sun, mastering that. And then after the second year, you take science boards. So we pass the board exams. And then the next 2 years, you're still studying different things. And while others might be going off and learning surgery in a hospital and those sorts of things, we're doubling down on the clinical medicine. So we spend a lot of time in clinic. The medical school I went to over in Tempe, Sonoran University, they have basically like a naturopathic hospital there. People come in, you assess the cases with other students and the doctors, and we really, focus on the clinical side. The other part of that is that we have a broad base of tools, like you alluded to in the open, where we're also studying botanical medicine, the classic forms of that, acupuncture, and we really doubled down on nutrition, which is huge these days.
Right.
So those are some things that are really at the front of our toolbox, on that top shelf of the toolbox, as opposed to things that other doctors might shrug their shoulders and refer out to an expert and prolong the time that somebody's getting well inadvertently.
Right, right. And one of the things that I think we're so accustomed to is see a physician for 6 to 10 minutes. He spends a little bit of time with you and then prescribes something and kind of says, let's try this and see how this works. Um,
Exactly. And and that's all well and good. And it's done with all the best of intentions. And look, 9 times out of 10, they're going to give you come in with a cold or a real it's getting severe, and they give you an antibiotic and a steroid or something, and it's going to knock it out. And that's wonderful. And then, you might not see the doctor again until you get sick again.
yeah.
And by then it's almost too late. Now, you mentioned that most people go in for an annual physical. But some people are stubborn and they're like, well, I feel fine. Why would I need a physical this year? And then they're going 2 and 3 and 5 and 10 years. And then, all the things they feared were going to happen. Then, you run a higher risk of those things being found, when you're not feeling well. And so, our paradigm's a little bit more like the dental industry. You come in every couple years, we run the labs, and then when we're looking at the labs, which we do very extensively, labs have a lot of jargon on there, a lot of acronyms and initials, and some things are bolded out and they can kind of freak us out. We really go through those very thoroughly. We explain what everything is. We explain the connections between the various points. And if something's a little bit off, we can really kind of calm people down. A lot of my patients will, get their labs before they come see me, and they're on Google and they're, oh my gosh, what is this? And really, in the absence of other, corroborating data around it, it really doesn't, I look at it and I go, oh, that's not a big deal. You're 1 point over the range. That's, totally normal in this situation. And so we spend a lot of time going over the labs, the connections, and then I think at the end of the day, Armando, we're really strategists. We really put, not unlike what you do, we put together a strategy for a person for their health and wellness. And we start gentle, and then we kind of work our way up to the medications and surgeries. Even though I'm a naturopathic doctor, I think a lot of people are surprised to know that we do prescribe medication, and we have a broad license here in Arizona. I can prescribe anything up to, like morphine, basically, that you wouldn't get other than a hospital. So, we just use the right tool at the right time. And then, knowing the person very thoroughly, we're able to, really, get them to their optimal health.
Yeah. And Dr. Well, you mentioned labs, and I know this is a basic question, but I'm not clear. Labs meaning you're taking blood work and then seeing what that tells you?
Correct. That's exactly right. So, we like to do that with the men a couple times a year and with the women a few times a year. Everybody's a little bit different, but yeah, we will run a broad panel of, labs, usually drawing blood. They'll do blood count. They'll look at metabolic function, kidneys and liver function. We also will draw thyroid. We draw hormones on people, but not just like estrogen and testosterone. We look at the entire cascade to say, is there something that's kinking up the chain? With that, we look at things like vitamin D, which is so terribly important. Even here in Arizona, where it's sunny all the time, and most people know that we make vitamin D from the sun hitting our skin, most of us are indoors, and most of the people I see are very deficient. But it's a very important vitamin, even a hormone that regulates our gut health, our hormones. And overall well-being. And so we'll look at these things, we'll test, and we'll optimize, and again, connect the dots between things. So a lot of times, with my busy entrepreneurs, the number one condition I see is really stress. And then when we're looking at the hormone cascade, we can see that it's all steering toward cortisol, which is our primary stress hormone. And then it's putting a lot of other hormones and other markers on pause until people are getting out of that fight or flight mode and calming down a little bit, and then those things can start to. So we'll see patterns like that kind of emerge through the labs. Again, particularly with my executives, entrepreneurs, and busy professionals, and we help them make some lifestyle optimization choices and may give them things like, nutritional supplements, botanicals. We have different treatments in our office at Chambers Clinic. So it really just depends, but it's a custom picture for each person. I have people who come in with a specific diagnosis, let's say like heartburn, but I could see a dozen different people. They got there a dozen different ways. So we really respect the individual, how they got to that level of health. And then, we start to get worried. And so we're able to, do some things not only to calm the symptoms down, but get to the root cause so it doesn't come back.
Okay, fantastic. And let me ask you, it seems like there's a lot of stress, anxiety, and depression out there.
Mhm.
And it seems that there's a very standard protocol to prescribe drugs for those. But I've heard you say before in a conversation that there are other ways to help address some of this as well, that you as a naturopath physician look at that differently, you treat that differently. Maybe you can touch on that a bit if you don't mind.
No, I'd be happy to. Like I said, it's about the number one thing I see is stress. And we all have busy lives. Many people have a busy family life. They're getting kids off to school, that sort of thing. They're going to a job after that. They're, running kids around. In many cases, I'm a little bit older. I'm in my 50s. In 50s and 60s, we start to get to an area where we're managing our parents and their health. And
Right.
sometimes they need extra care to move into a facility, or sometimes the parent will move into, the family home. And so, there's all these life stressors coming at us. And then you kind of layer in, the news and social media and a lot of the things that are, coming at us on a regular basis. And like, oh my goodness, it's an overwhelming amount of things that, come at us day to day that we've really got to manage. And so number one, some of those things can be mitigated. Others are just, hey, my mom lives in the house, and there's other things that we just have to deal with. But there's also ways to make sure that our energy is optimized so that we have the wherewithal and the brain function and the vitality to be able to to attack these things day to day without getting completely drained. And so that's what I see a lot of chronic stress. It's kind of like you're revving the Ferrari at 200 miles an hour, and then after a while you start to run out of gas, and we got to refuel the tank. And so we really just kind of look at the big picture, look at the entire car and say, what is going on here? And then we're able to cherry pick the things that, with the best and, most effective interventions really kind of help to make those adjustments. Sometimes it's lifestyle, sometimes it's diet. In my case, I was a stressed out corporate manager. I did corporate communications and public relations. I was a spokesman. I was getting, slings and arrows from the media on a regular basis. And, I kind of took all my stress into the gut, and that started to get off track. And the naturopaths are the ones that help to put it back together. So it presents a little bit differently in everybody else, but we really just look at the individual and get to the root cause of what's happening with them.
Wow. See, you mentioned nutrition as well and maybe supplements. And I've heard
Mhm.
you say before, Dr. Wool, gut health, that
Yes.
is central, that is core to the overall health of the human body. Nutrition and gut health, one of the I have two physicians in my family, and they've both told me they've taken literally zero classes on nutrition. And one is a cancer radiologist, one is an OBGYN
Yeah.
physician. And they both said the same thing, which to me seems, I would expect some knowledge of nutrition. And you, of course, in the way you look at the body and human health, you factor that in. How does that come into play when you're meeting with a patient? Say if I came to be your patient and you're asking me questions, what would that look like? How might that play out?
Absolutely. Nutrition is a front of mind for me. As I always say, and this happened to me in med school, diet is undefeated. If you have a healthy diet, you will have healthy energy. And so, when it comes to that, the medical system lets us down a little bit. Yeah, you're exactly right. They're not trained in nutrition. They're trained to, treat the symptoms of what's in front of them.
Yeah.
For instance, I mentioned gut health. You mentioned gut health as well. Like, if somebody's starting to get heartburn, they'll refer you out to get a heartburn medication. they will sooner send an endoscopy down your throat than actually ask you what's on the end of your fork. They'd rather outsource that to somebody like a nutritionist. And really, the medications for something like that, for instance, are over the counter. They're inexpensive. They work pretty well. But once they've run their course, then what, right? So we really play in that gray area, and nutrition and diet are like the first place. For nobody ever asks what's fueling you. And then we also don't ask, like, is what's fueling us creating the issue in the first place? There's a lot of processed and fatty and fast foods out there.
Mm.
And, we live in a convenience culture, particularly when we start getting really busy. We may have the best of intentions of going to the grocery store and, getting a bunch of groceries and preparing our own meals at home. But, when we're really busy and you get home at 8, 9 o'clock and you're just looking for something quick, it's going to be a lot easier to go to the drive-through on the way home. And so, we just take all of that into account. We realize that people can't be perfect, but if we can steer them somewhere 80, 90% of the time, or use diet as a tool to help them get out of inflammation, to get them out of poor health, people are genuinely surprised. We turn around diabetes, for instance. I had a
Wow.
patient with a A1C is the main 90-day blood marker to tell us, well, how bad is the diabetes? I had somebody with an 11, normal's 5.6, and he didn't want to go on medications. We created a diet program, and within a month, he was back down to 7, and now he's in normal range after 60 days. In that case, somebody would have given him high doses of diabetes drugs, probably injectable insulin, things like that. And then you're down kind of a slippery slope process, particularly in that disease. So, sometimes we can start with diet. They're not always the most comfortable changes for everybody, particularly those who are busy, but we make it very simple, very practical for the patient. And we're able to, use that as one of the tools to help, steer their health in the right direction. Having been there myself in the corporate world, and I realize that practicality is just about everything when it comes to diet, because oftentimes we don't know what to do. But once we learn, it's very simple, and we can really fuel ourselves by with what we put in our mouths, and it really makes a massive difference to somebody's energy.
Wow. And are there common reasons why people are coming to see you for the first time? Let's say you're the first naturopathic physician they've ever seen, and
Mhm.
they're coming to you for the very first time. Are there common reasons why they're coming to see you?
Yeah, I think generally, Armando, it's like, particularly those of us who've had parents who've gone through things, or close friends who've gone through things. I can remember when my dad was an executive. I can remember when I was a kid, he'd start to get gut issues, or he'd have to go in for a colonoscopy or something like that. And then when we get in our 30s and 40s, and these sorts of things start to crop up a little bit, and we're going, oh my gosh, I have what my dad had, my grandfather, my uncle, my mother had this. And
Yeah.
boy, oh, that darn near killed her. I better get in and go see. The other thing is a panic starts to occur as well in that scenario I mentioned up front, which is that I haven't seen a doctor in 10 years, and now that thing, somebody might get heartburn, for example, which feels like a heart attack. It's one of the number one reasons that people go to the ER, because they're having just heartburn or indigestion, but it feels the same as a heart attack. And so they go in to make sure that that's not happening, which is the number one appropriate thing to do. But it sends your brain kind of down the hill. It's like, wow, I've been healthy, and now all of a sudden I've got this thing, and I don't want to have the thing. I want to be healthy, and it really calls our mortality into question a little bit. I hate for that to sound heavy-handed. It's not. It's not meant that way. But like it's like, oh my gosh, I have what my parents have, and yeah, that's definitely a common denominator. And the other part is when something simple. I'll keep going back to heartburn because I see a lot of that. I see a lot of heartburn, IBS, doing gut health stuff. When something simple like that, for example, it becomes chronic, when you're having heartburn every day for 2 weeks, 4 weeks, months, and years, and you're using a drug and it's not addressing it, or the heartburn starts to break through a simple over-the-counter treatment that you have, that's another story. IBS would be the same thing, and IBS diarrhea. Let's talk poop. But like, if, for example, like I think most of us have had, bouts where we've gone on vacation or, we've had a bad food at a restaurant or something, and, we have a day of loose stool, a day or two, but then it's chronic and somebody's planning their entire day around how close they can be to a toilet.
Yeah.
Now all of a sudden, that becomes very serious. And, that's something where you want a big picture look, beyond simply prescribing drugs to manage some symptoms. So we look at the whole thing because there's many different causes for each of those things, and then we really talk to the patient, get a good sense of what's going on, and then pick the right things, not just simply throw them the standard of care that's the next thing down the algorithm when they're looking at heartburn. So,
Right.
those are basically the two things that I see when people come in. The hardest one, just to add this, is the prevention piece. We all want to be well and we all think we're well, but it's a strange thing to come in to the doctor when you're feeling well, but it's really critical. You want to check to make sure that every time we run the numbers, it's more or less the same, or that it's going in the growth trajectories that we want, just like a company. You want to have, let's say, you're aiming for 20% year over year growth. Well, you're going to measure that quarter by quarter, right? So we want to make sure that, if somebody's cholesterol is high, that the trend is coming down. We want to make sure that if somebody has a certain level and it's at a very healthy and optimal level, that it stays there. And so the only way to really know is to check on a regular basis. And then if there's abnormalities, we can jump right on it, as opposed to somebody, again, waiting a year, 5 years, 10 years. We've seen this with like prostate specific antigen. This is the marker we test men for to see if they have enlarged prostates or a risk of prostate cancer. And somebody might have a good score 1 year and then not go back to the doctor, and then the velocity of something that was brewing in there has gone out of control. Whereas if it's something that we check every 6 months or so, it's like same, 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 and then all of a sudden it jumps up. It's like, okay, what is this? And then we can jump on it, and you've caught something. If it was brewing very, very early, it makes it imminently treatable, and you're not in crisis. And when it comes to executives, entrepreneurs, the families that you're dealing with, those crises, put a major wrench into an operation, for instance, of a business. It puts a major wrench into family stress. Now you're dealing with something that is going to be longer lived. 2, 3, 6, 12 months of treatment and recovery from something, as opposed to you caught it, you took some supplements home, and it never became an issue in the first place. So those things are trade-offs. It's really hard from a prevention standpoint, but hopefully that's illustrative of the need to do it.
Yeah, no, that's extremely beneficial. So you mentioned nutrition. You also touched on botanicals and supplements. You've got your tool chest is much broader than, say, my normal primary care physician.
Mhm.
In that broadness of what you have available to you, things that when you're looking at that overall picture for that person, botanical supplements, what else are you pulling in from your toolkit to potentially help that person?
Yeah, we're looking at a couple things. Number one, it's what's the most effective tool, and then what's the least harm intervention, right? What's going to get the job done with the most minimal effective dose, and what's going to do the job better and do it in a way that's more gentle. So when it comes to botanicals, they've been used as medicines for centuries and millennia throughout time. A lot of them have even been, they switch the molecule slightly, they patent it, and boom, you have aspirin, or you have some other very small thing. Gout. I had somebody in yesterday with gout. The cure for that is cherry juice, and they turn cherry juice into something called allopurinol, and people take that to help prevent and get out of a gout attack. So, all these natural substances have been around for hundreds and thousands of years. And so we respect that pharmacopoeia, and it's usually very gentle. Herbs have a gentle effect. But we really just meet somebody where they're at. If somebody's in a very serious chronic state and a medication is the right intervention for that, it's generally the standard of care. We always follow that. We're going to do that to get them out of that, but we may use, other things botanicals, acupuncture, other interventions, nutrition to try to get people out of, as an adjunct to get people out of the situation. But we can really pick and choose among these, but we always start gentle and then work our way up to medications and, heavier medications and surgery.
Okay. And Doctor, well, when someone comes to see you for the first time, they've got some reason why they're coming to see you. Let's say they're not healthy and want to maintain, but they've got something happening.
Mhm.
What is that? Just walk through that process of that new patient coming in. How do you, what's that conversation? How does that go? What is that next step? What does that plan of care look like? Time frame? Can you touch on that, please?
Yeah, most of my patients, new patients that come in, they have a 90-minute deep dive visit. We go through everything, all the organ systems. Most people are coming in with concerns of some sort. They've been experiencing some chronic issue. Maybe it's just as simple as, hey, it's January and I want to lose some weight. But we take all their concerns into account. We ask a lot of questions related to the concerns. So going back to the GI, well, I'll ask a lot of GI questions to make sure that like any doctor, we're at an effective and accurate diagnosis for what is going on. And then the other thing is if they're coming in with multiple issues, are these things linked or are they parallel incidents kind of happening on their own? So that's a process we go through as well. So based on that, after the big deep dive visit, we'll run some labs. General wellness labs are what we'll run, but also have access to a lot of specialty tests. So in the case of gut health, there may be like stool tests or breath tests to diagnose certain conditions. In the case of sometimes we'll have to refer out. So, like in the case of heart disease, we may refer out to imaging or refer somebody actually to the cardiologist. There's lots of different specialty tests out there that we can run. Ranging from trying to find a parasite in stool to trying to look at the totality of a body for cancer. So it really just depends. And like I said, every patient is new and individual, and we just treat it as custom care. But a lot of times those gentle interventions, work just great. They're practical. They're things that people can just do day to day, to maintain their health. But if they are in a chronic state, we get them out of the chronic state, make sure they're feeling okay, and then we figure out how to one, make sure that they don't go back there we give them all the tools and strategies to be able to do that.
Wow. Wow. And it sounds like I think you said early on in our conversation that, back in the old days with the family doctor who really understood, spent some time with you, knew the family.
Mhm.
That sounds really more of where you are and how you're spending that time and understanding more, not just this pain that they have or this thing going on, but what's causing that pain versus a band-aid on it or a drug to address that specific thing. What's the cause? Going to the root cause.
Yeah, absolutely. I mean, at the end of the day, I really care, and when you spend a lot of time with people, and things aren't going well, or, I sharpen the pencil and really go to the mat for them to try to figure out what exactly this is. What's the root of this? What is going on? But yeah, we really, at the end of the day, we really care. And it sounds so crazy to have to say that out loud. And I think all doctors really care. It's just they have a limited amount of time or a structure of their practice that it really is not conducive, unfortunately, to spending a lot of time with somebody even on a first visit. We really, we put in that time. And then when things, go great, I want to make sure they're continuing to go great. And when they're not going great, I want to make sure that we're drilling down as much as possible to figure out exactly what's going on, change course, create some other interventions that are gonna, get us and help the patient reach their goals.
Um, so my mother is 90 years old. She had eye surgery recently, and I took her to the surgeon, and then we did
Yeah.
follow up and some other follow-ups. I was so disappointed. Actually, I was actually upset with uh, not the care, the level of medical care that she got. I think it was appropriate and it worked so great. That's the outcome you want, right? That when you have a procedure, that you have the outcome you want. But just the facilities, the bedside manner, the I was just very disappointed. It was kind of the anti what you've described, where you're spending the time and asking questions and saying, "Hi, how are you?" You know, when you greet the person. It was just not that at all. I was actually very irritated, very upset about it. But the medical outcome was what we wanted. So great.
Yeah.
All's well in the end. But I
Yeah,
would,
and every doctor's a little different on bedside manner for sure. And a surgeon, for instance, is going to be, no pun intended, very just cut and dry. Hey, we did the surgery, it worked, and
yeah.
move on. Yeah, it really just depends on the person and the care. But yeah, the time spent is definitely a big feature in clinical medicine.
So I'd like to ask you about botanicals again. Botanicals, it seems, at least from the very, very little that I know, that there's still a lot of discovering being made in terms of what botanicals can do, the strength of them, what they really can impact the body with, and how that all happens. Is that there's a lot that is known and a lot that still is yet to be discovered about botanicals?
Definitely. And I think you got to have a skilled practitioner as well. So I think there's a lot of botanicals out there, for example, that, we all, know about. But, botanicals are medicine. There are low dose botanicals that are as strong. And when I say low dose, they're very high potency, and we have to give them very carefully in low doses. There's some very strong ones out there. And I think a lot of times when we're not feeling well, what happens is we ask our family and friends, or we'll go online and search different things, and we'll see a supplement that works for our condition, and we'll get that, and it will have some herbs in it that may help. And but I think dose makes the medicine. Selecting the right herbs. If I was going to make a tincture for somebody, I always feel like I went to Hogwarts, and like in Harry Potter. But we actually do make the medications sometimes where we have a number of different things, and we're looking at, okay, what does this person have? What are the types or categories of botanicals that we need to actually employ here? Do we need to employ anti-inflammatory herbs, or something that's like what's called a mucilage, which is like a little bit gel-like, that helps to coat and soothe the stomach, for instance? Is it something to vasodilate, open up the vessels? Is it something that is going to be a lymphagogue, for example, which helps to move junk out of our sewer system, called the lymph system? So we can say what herb should be leading this tincture, what's going to be the most effective, what are some supporting herbs that are going to also do these other secondary jobs, and how are they going to be synergists as well? How are they going to work together? Can we create kind of a custom piece of medicine with four different, botanical extracts, to create something? And then oftentimes too, people have already created some of these, and, we have knowledge of, what are the best pharmaceutical grade herbal preparations that are, coming in a bottle, that we might have in a supplement store, be able to order for somebody online. And then you have it kind of mediated by a doctor who actually knows, what these herbs are, what they do, what the cautions are. When we look at a monograph for an herb, it looks exactly like a drug. It's like, hey, don't use this in pregnancy. This is a category, B, which is a higher risk. This is, and we're looking at all those different things. But if you're kind of just looking willy-nilly online and shrugging your shoulders and go, well, I'll try it. And
Yeah.
it's people forget, with nutritional supplements and botanicals, you can overdose on those as much as you can. Any kind of medication. So it takes some, a careful practitioner who knows the difference. And, patients ask me all the time, say, hey, I saw this online. What do you think? And I'll look at it and I'll know their condition. And I'm like, yeah, go for it. That's great. But oftentimes we'll also quarterback that for people.
Yeah, that makes a lot of sense. I think that in general, we just don't, I mean, we who are not medical professionals like you, we think of botanicals not so much as medicine, but as a plant,
Mhm.
or a
Yeah.
fruit, not really as medicine.
Right, right. And that's really important. It's a really important distinction, or because we think it's a plant or fruit, that it's benign, like a banana or something.
Yeah.
And some of them are, but most of them are not. You really got to think it through about, okay, how did they make it? What's the delivery mechanism? And what's this thing actually do? And is it the correct thing for is it the correct intervention for the given issue? And sometimes when we're not as aware, taking herbs and botanicals or certain supplements can create other downstream problems, or just not even address the one that you were trying to address in the beginning. And then I've seen this too, where people will continue to take that, and it's like, man, I don't know if it's working or not, and then they'll layer on things, and you could be just like combining medications. You got to be really careful that you're not doubling up a certain mechanism of action, or depleting something, inadvertently in the process. So it just takes someone who knows a little bit more to, at least help to quarterback that for someone
And
as
I would like,
partnership.
I'm glad you brought that up. I've often seen with, as people get older, they get on medications, then another medication. And sometimes elderly people have a whole pill box. They take all these pills and other stuff. But the common question that I have when I see or hear of that is who is coordinating all those drugs to make sure they don't counteract each other or they don't together negatively impact the patient. And I don't know that is there somebody who is really doing that or not really?
Not really.
It seems like not.
It's yeah, I would say, every doctor is looking at it. I think that is definitely happening. So somebody prescribed a medication, right? Let's say you came in with hypertension, high blood pressure, right? And that the correct intervention in that situation was to give the person an antihypertensive medication. So they put them on it. It corrects the problem. You get joint pains in the hand or something like that, and now you go to a rheumatologist. It's a different specialist, and they give you a medication, and now you're on two. You're on your hypertensive. You're on your other one, and everybody. So two things. One, every specialist is going to look down the barrel of just their specialty. The gastroenterologists are going to look at gut, and that's it. The rheumatologists are going to look at your joints and muscles, and that's it. The cardiologists are just going to look at your, cardiovascular system, and more or less that's it. And the other thing is some of these medications have known side effects, and so the prescribing doctor will prescribe a drug for the side effect. If, for example, if a medication created diarrhea, they'll give them an antidiarrheal, and it fixes the problem, and you move on. And then by the time you've gone specialist to specialist, you've got a huge stack of medications, and it's really hard to unpile the bricks in the stack because each one is doing a different thing or it's covering a different side effect. And nobody has talked to each other. There's no quarterback. I keep bringing that up, but
Yeah.
it's a lot of what we do in strategizing for people. Nobody's talking to the other hand and saying, well, why was this person put on this? Oh, as a side effect of this medication. It's like, well, their blood pressure's fine. They lost 30 pounds, and they don't need this anymore. And you got to just like look, you got to look at it and make sure that, I see polypharmacy all the time. I have people that come in and they're on 7 or 8 different medications, and like, well, how long have you been on this? 30 years, 20 years, 10 years.
Wow.
Why did you get put on it? You know what? I don't know.
Wow.
And but the doctor says to take it, and then the doctor's offices just renew it ad infinitum, because nobody's complained to them. And back to, people not going to the doctors. Like, again, if you had hypertension, you get put on a drug like lisinopril, it brings it down, and everything's happy, and you're testing your blood pressure at home, and it's 120/80, the normal, and great, drug's working, and then nobody ever thinks about it again. But then you start layering all these other things on board, and now all of a sudden it's very difficult to move off of some of these medications. So medications are great, they're very helpful, but I also think that people end up on them too long. You were also alluding to like antidepressants, for example, SSRIs. Those work amazingly well. Every doctor knows that if they put a depressed person on a SSRI, these are drugs like Lexapro, um, Prozac, things like that, they know that within a couple weeks they're going to feel better. It's true. Antibiotics are the same way. If somebody's got an infection, you put them on an antibiotic, they're going to feel better. And that's why a lot of medical doctors will give drugs during a cold, because they're like, well, if this progresses to something serious, they are already down the road on the antibiotic, and we know it works. And if they don't hear from them again, they're like, thumbs up, it was great. So, but the long term is like going back to the depression example. somebody might be depressed, for example, because the grief from maybe losing a loved one, or a child going off to college, or or something that really kind of takes our mood down for an extended period of time. You throw the antidepressant at it, it brings the mood back up, and then they just kind of leave people on these things for years and years, and they just kind of plateau and they feel very flat, and they don't remember why they were on it in the first place. But the real reason was that they have this incident where they needed to get over the hump for a couple months, and then in a perfect world, you'd wean off of the medication and then go back to your normally regularly scheduled mood. And so those are the things that we look at very carefully in our clinic and say, well, is there something better? Or if you're going back to that root cause and saying, well, gosh, you were just depressed for those couple months because, you lost your mom, that was 10 years ago.
Yeah.
So
Yeah.
you probably don't need it now. So we look at everything kind of case by case, and then again, getting down to that root cause and asking why a lot. Why are we on this? Why are we feeling like this? And just kind of looking at that big picture and drilling down is a huge part of what we do.
Yeah, and Dr. Will, I think you said that also, as the physician quarterbacking things, you may need to send out to a specialist and have
Definitely.
that specialist take a look at them. But again, you're still part of the picture. You're still making sure, and in terms of those overlapping drugs that they might be being prescribed, you are there to take a look at that and keep an eye on that for them.
Yeah, absolutely. And we also, we're very good about forming teams. I don't pretend to know everything. I am not a cardiology specialist, for example.
Yeah,
I know the basics like any, family physician, but we want to team up with that specialist, one, to advocate on behalf of our patients. Hey, this is what, this is what I'm seeing. Please evaluate these things, go through your process. And then, also when the patient comes back to say, hey, what did they say? Okay, good. I like this. And then we also need to do these other things that cardiologists aren't good at.
yeah,
We go back to diet, for instance, that every cardiologist, when they see a mildly high cholesterol before somebody goes on a medication, they'll say, you're only in kind of stage one here. You need to adjust your diet and lifestyle, and then it's okay, and they're out the door. You don't know what that is and what to do. So we make a really great team for a lot of these specialists. I refer to a number of doctors all the time, and we can help team up on behalf of the patient so that if something is askew, they've got a whole bunch of people in their corner. It's not just these individual pockets. You're really like you really get everybody. And then if we need to, drill down and ask more questions, we can. You end up kind of like with your own little Mayo Clinic, in these
yeah,
instances where you get
yeah,
everybody's heads together. And I think that's really important in somebody's care. Have
yeah.
someone in your corner like that.
Yeah, well, I hadn't realized how similar your business and ours are because we're the family CFO and we're working with the outside tax attorney or tax CPA or the actuary or the insurance agent, et cetera, and coordinating that on behalf of the client, being the advocate for them, which is just what you described as well in how you're doing things.
Yeah, for sure. It's really funny, Armando. We talked about this before where, this is my second career. I did corporate communications and public relations for startups, Fortune 500 companies for 20 years before I ever decided to go to med school and become a physician. And it's very funny. When I was going through that process, I was like, my gosh, I had this 20-year career. I have all this expertise. I'm throwing it out the door. I'm never going to use this ever again. I was consulting all these different types of companies, and really what we do is consultative. I'm still using the exact same skills like you're saying, where you're looking at the picture and you're trying to organize the resources and the
Yeah,
best resources to help, and then you're facilitating these dialogues so that everybody is on the same page. And
yeah,
I do that on a day-to-day basis as a physician. And once I realized, I was like, oh, I haven't lost all this 20 years of of wisdom I had in the communication world and in the corporate world. But we really, that communication really comes into play. We can help to facilitate that, build teams if we have to. Usually, it's a little more straightforward, but yeah, it's a major piece of it, and we really help to knit the picture together for people. And I think that's something that's unfortunately absent in medicine right now.
oh, fantastic. Let me ask you about sleep.
Mhm.
It seems that sleep many people can be short on sleep. They need more sleep. They just can't sleep,
Mhm.
and people come to you for a variety of things that are happening in their life. When somebody is not getting the right sleep or enough sleep, your process, I imagine, is the same. You're having that intake, you're doing your labs, seeing what the labs tell you, and that is kind of your launching points.
Yeah, for sure. But usually sleep is an area where we can intervene, but before we get all the data back, it's usually an area where we can intervene. I see it a lot. Again, number one thing I see stress.
Yeah.
Stress is always well, almost always gonna wake somebody up who's having poor sleep. I will hear I have no trouble getting to sleep. I'm tired at the end of the day. And then almost at the exact same time every night between 2 and 4 in the morning, they will wake up, they'll be up for an hour, and then they fall back asleep. They wake up at 5 or 6, to get ready for work or whatever, and it feels like they didn't sleep. And then this happens day after day after day. And what I really focus on, in the prevention side of things is nailing the basics. So we need to sleep, get great night's sleep. Reorganizes. Drains all the junk out of your system, reorganizes your brain, wires you for success the next day. And then, fueling yourself with diet, after that repair and recovery from sleep, and then, getting good, decent movement in every day. And then I would also layer in connection among people, being part of social groups, seeing people on a regular basis, interacting with people on a regular basis. Sometimes our society or social media and these things, can be very isolating, and that creates some stress as well. So, but sleep is huge. That's our repair and recovery, and it's usually a low-hanging fruit, particularly after that first visit, before I'm getting all the data back to be able to intervene and say, hey, let's try a few things here. I would say just offhand, most people don't have a bedtime routine. Particularly those who are entrepreneurs and executives that are up late working, they got a spreadsheet in their face, or they've got a screen in their face, and then you go to sleep, and that stuff's still kind of burned in your brain. It might take a little while to wind down. So we really help people set some boundaries, really wind down at night, spend an hour or so winding down at night, a couple hours ahead of that, putting the screens away, the scary movies, whatever somebody's routine is at night, and just really focusing on the basics and winding down. And then, if we're still popping up in the middle of the night, that's a place where, herbs and other things, or just like simple interventions like eating a little bit earlier, a big meal, avoiding alcohol on a weeknight, for example, which would also kind of provoke the liver and wake someone up at night. So, we just look at the totality and say, all right, why is this person not sleeping? But oftentimes it's stress. We study acupuncture and Chinese medicine. The liver holds the emotion, and it holds all the blood. So if there's, quote unquote toxins in the blood, or somebody's like really processing something emotionally or had a rough day, that liver, it's time to work at night. There's like a clock. You can look this up on Google, acupuncture clock, but like 2 to 4 in the morning is generally liver time, and liver will wake you up. We're supposed to be kind of full of melatonin. That's our nighttime hormone, keep us asleep. But what ends up happening is we spike some cortisol. That's our stress hormone. That's our daytime hormone. And then again, you get that pattern where you're up for an hour. Melatonin's kind of sitting aside, waiting for cortisol to diminish, and then it will kick in at a high level, put you back to sleep. But when you wake up in the morning, you're going to feel fatigued. So that is one of the most common patterns that I see, and it's really
Wow.
very correctable once we identify it.
Wow. That's amazing. I didn't know the liver held emotions.
Well, if you study acupuncture, which is 5,000-year-old Chinese medicine, they figured this out a long time ago. But it's one of those things that tracks. It's funny, you learn all these different systems of medicine, and you go, okay, that's great. We practice the standards, we prescribe medications and other things, but that system of medicine, they nailed that one with sleep. People wake up in the middle of the night, and for the reasons that I mentioned, alcohol, large meals, anxiety, lots of ruminating and thinking. Those are the things in Chinese medicine associated with the liver meridian that wake up in the middle of the night when it's got its time to work. So yeah,
Wow.
it's actually fascinating. But yeah, we can kind of knit together all these different medical traditions, whether it's botanicals, acupuncture, standard of care MD stuff, and really create a functional program for somebody.
Wow, fantastic. So when someone should come see you, or the question actually is, when should someone come see you? Is it they've not been getting results, or they're not getting the right answers? They're maybe been prescribed drugs and on those and it's just still not working, or it's an ongoing. The question really is, when should people come see Dr. Wool?
Absolutely. Well, there's a few different times. One, when something that's fairly acute has developed into something chronic. What's happening there is that it's something that can be addressed with a simple medication. It plateaus or it just doesn't seem to be working, and you're still feeling not so good. The acute care model from the hospitals and the medical schools and things like that, it doesn't really translate very well to chronic care. They still want to hit it with the same medications, and that's where you really got to upscope and look at the bigger picture. So that would be a situation to come see me. I mentioned up front, I do executive and entrepreneur health. I think most people, when they get to that level, they may, when they're looking at like E&O insurance, for instance, or just getting a life insurance policy, to insure the family, or insure the business against a prolonged absence. I think people get those tests back and they're either surprised by the results or they haven't been to a doctor in a very long time. And it's like now you have a phlebotomist drawing blood and you're like, oh, wow, I'm really afraid of what they're going to see. I haven't been to the doctor in a really long time. I think that's a really good instance as well, just because we can really, help to calm people down around that and then also put together a real program of optimal health and prevention so that they can serve everybody that they need to serve. And then I see a lot of people in their like in their late 30s, early 40s. That's kind of the age that men and women realize they're starting to develop a lot of the same symptoms and things that their parents or
Okay.
a close relative have, like we were talking about earlier, and they start to get a little scared. And that could be anything ranging from having, put on 20, 30 pounds and it won't come off to, having, chest pains or chronic GI issues. So, depending on what those are, it takes a practitioner who can spend the time, look at the bigger picture and drill down and say, okay, don't worry. Here's a program. It's pretty gentle. And also, while helping people stay safe and stable, like any other doctor, really help to, calm things down. I think people who we have all the information at our fingertips, but I heard comedians say this, all Google searches lead to cancer and heart disease. And, those are the endpoints that tend to freak us out. And, I don't want anybody freaked out in my practice. I want to make sure that they understand their health. I think a lot of us have gotten away from, paying attention to what our bodies are telling us. And so I kind of help the patient listen to that as well.
Fantastic. Yeah, you're right. Everything is online, whether it's accurate or not, it's
Yeah.
online. And if we don't know any better, we might assume it's accurate when in fact it's not at all.
Yeah, yeah. Our brains just take it to the extreme, unfortunately, and particularly if we're stressed out, they're just gonna steer it there in a lot of people. So I'm here to say I'm gonna steer you right back and say, don't, here's what to focus on. And here are some things to do to optimize.
Yeah. So you mentioned nutrition, botanical supplements, acupuncture. Are there other parts or other I guess what else is part of your holistic view of that person that you're trying to help that we have?
Yeah, and it really comes down to what's practical for the person as well. But in our clinic, I'm in a larger clinic, Chambers Clinic up in North Scottsdale. We have 5 other doctors there. All of us each have different specialties, but the clinic itself has a number of different modalities there too. We have IV therapy, for instance. We're kind of drip a bag of nutrients directly into the system to help the immune system and other things. We have a hyperbaric oxygen chamber, for instance. We have an infrared sauna. And I mention those things because sometimes what we can do is, stack these different things together in order to facilitate wellness or to get the body to heal in a certain way or to get the body to heal faster. And we also have a bit of a brain trust there too. So I don't, like I said, I don't
Yeah.
pretend to know anything, but
Yeah.
I can bounce that off other doctors in my group and say, what are we really looking at here? This is what I've done. Here's what I see, and we can kind of pull together the best ideas from the best disciplines to really help somebody. The interventions I'm talking about are all incredibly effective, and they tend to be more effective than those in standard medicine. And in standard medicine, really just hits a lot of things with one hammer, and that is medications, or
Yeah.
if something's very extreme, a surgery. And there is a time and a place for both of those things. I no doubt I prescribe medications every day, but there's so much else out there. But there's also a lot of noise, and it just takes good practitioners to be able to discern, what's what, and create a individual strategy for someone.
Dr. Woods, probably the last couple of questions for you.
Yeah, sure.
Cancer is so prevalent.
Yeah,
It's just so common in people, even younger people now today. And of course, there are lots of cancer specialists out there. That's what they do day in, day out. From your perspective as a naturopathic physician, when someone has been diagnosed with some level of cancer, you 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 can be helpful to them as well, or is that the realm of a
absolutely.
cancer specialist?
Yeah, and you definitely want to work with an oncologist, a cancer specialist. But a few things with that. Generally, with cancer, depending on the staging of it, the protocol is cut out the cancer. And based on hospital availability and that sort of thing, somebody's diagnosed with cancer, it is an incredible shock to their system. Half the time, they're not even listening to what the doctor is explaining to them because they're in just such shock,
Yeah,
and then they'll say, okay, we got to get you in for surgery on Tuesday. And it's like, what? Wait a minute.
yeah, yeah, yeah.
I will say, 9 times out of 10, cancer is not an emergency. And it is okay to, call time out and to, consult with others. I'm not a cancer specialist. I have a colleague who is a cancer specialist and does naturopathic cancers. So two things with that where naturopathic doctors can help. My colleague's Dr. Jake Pasenka. He's been doing this for 20 years, but two areas where I see him help people out all the time is one, going through the standard of care when someone is doing radiation and chemo, being able to use naturopathic methods alongside that to make those drugs more effective. And second is to mitigate the side effects of things like that. Those things can be incredibly draining, but
Right.
there are things that we can do naturopathically to help somebody keep their energy up, or if or to mitigate the side effects. If somebody has got horrible vomiting or incredible fatigue, those are some areas where naturopathically we can step in alongside of their oncology care and really help them thrive through cancer. And then the third is to maintain remission. Many of the people that we see, the cancers are staged very low. They do the standard of care interventions and they are better. And then our care helps to maintain that remission. What most oncologists are looking for is a 5-year survival, right? They have those rates at the ready based on the stage and type of cancer that somebody has. So what we want to do is make sure that once the cancer is gone, that we leave it gone, and that we coach people on exactly what to do so that they can maintain a healthy remission for as long as possible, hopefully for the rest of their lives.
Wow. Wow. I've learned a lot, Dr. Wool. Thank you so much for this conversation.
Yeah.
Let's say that somebody heard this and they really want to meet you, talk with you, and have a conversation with you. You mentioned an initial appointment. How would they schedule that with you?
Yeah, I offer a free discovery call, 15 minutes. No one ever leaves that call without any direction. There's no obligation whatsoever. I am always happy to help people. You can book that through my website. It's drdanwool.com, drdanwool.com. And I'm always happy to talk with people and, and talk to them about their care. So that discovery call, is really the best way to get a hold of me and
Okay.
talk through any concerns.
Fantastic. So drdanwool.com,
Correct.
drdanwool.com. That's where they can schedule that initial discovery phone call with you to have that first conversation.
Exactly.
Okay, great. Well, Dr. Wool, this has been fantastic. Thank you so much. I know that we're all trying to get in better health and be healthy longer and all that. And there's just so much information out there that it just gets very confusing.
Well, great. I'm happy to, provide a little bit of clarity for everybody. I was really privileged to be on your show, Armando, and I look forward to seeing you soon and helping anybody who calls for that discovery call.
Fantastic. Thank you. Very much enjoyed the
All
conversation.
right.
Thank you.
Thank you.
Hope you enjoyed this episode of the Founder's Guidepost. When you think about exiting your business, that's often a once in a lifetime event with no do-overs, and the stakes can be very high for your family. Before making that leap, ask for your free copy of our Scottsdale Founders Forum white paper, packed full with information that first-time sellers should know before exit. And schedule your 30-minute Founders Strategy Call at axiomcorp.com. Your exit can be amazing, everything you dreamed of, when you plan ahead and take all the appropriate and necessary steps. That's what's possible. Until next time, I'm your host, Armando.